History of medicine. Cultural heritage in medicine. The role of culture and ethnic heritage in healthcare. Our culture plays a major role in our view of healthcare. Refusal of medication or treatment may be based on cultural traditions. Religion, magic, and science play a part in the history of medicine. Do they still do that today? The beliefs of the Mesopotamians was that illness was a punishment by the gods. The beliefs of the ancient Egyptians was the body was a system of channels that came together at the rectum. The beliefs of ancient Chinese, they monitored the pulse in the wrist. They used acupuncture and moxibustion for treatment. Today's practitioners will agree that ancient Chinese treatments are still excellent guidelines. History's specialists versus today's specialists. There were witch doctors, medicine men and women, and shamans. Today we have spiritual advisors, social workers, counselors, teachers, and physicians. Medical specialists in history. Beliefs and methods of ancient healers. All healers drew upon some power beyond themselves. They used mind-altering drugs that were used by many ancient healers. Ancient healers' needs were supplied by their tribes. The rise of Christianity. The emphasis was placed on soul rather than body. Monks controlled the medicine. Saint Benedict of Nursia forbid the study of medicine. This went on for about 500 years. The Islamic religion preserved classic learning and encouraged medical study. In the 9th century, medical universities began in Italy and in France. During the Renaissance, physicians started to become licensed, and art and science were more closely related. Michelangelo and Da Vinci. They used dissection to draw anatomy. This picture depicts a Da Vinci drawing. Some history of attitudes towards illness. Isolation and abandonment in some cultures. The Good Samaritans, they were concerned for the sick. Native Americans treated the sick very kindly. Suicide during famine was a form of bravery. The Eskimos would put their elderly out on ice floes. Romans and Greeks disposed of their ill or deformed. Today's attitudes, we debate the right to choose life or death and physician-assisted suicide. People fear illness they perceive as threatening, such as AIDS. The public may treat people with certain diseases unfairly. In Cuba, if you have AIDS, you are contained to sanitariums.